Thank you so much for joining our webinar, Improve Quality and Efficiency in Radiology with STATdx. In this session, we will discuss the challenges faced by radiology practices, both in case of practice as well as in teaching. We'll highlight how STATdx can actually bring value to your teaching or to your practice. And then we will have a short demonstration of STATdx, the platform itself, followed by a round of question and answers. I'm very happy to introduce Griselda Varas, our Customer Engagement Manager. Thank you for joining us for this session, Griselda. Griselda is our internal expert on STATdx, and she will be answering all your questions and showing you how best to use the platform. Griselda, do you want to quickly unmute yourself and say hi to our audience?
Thank you, Natasha. As Natasha mentioned, my name is Griselda Varas Juárez, and I'm here as a Customer Engagement and User Analyst Manager. And part of my responsibilities is to conduct a demos of our decision specialty solution. I'm really happy to have the opportunity to show that to you.
Thank you so much, Griselda. It's great to have you here with us today. Before we begin our session, I'd just like to remind some housekeeping rules to our audience here. First of all, this session is being recorded, and you will have access to an on-demand version after this session. We will send it to you via email. We're conducting this in a Zoom webinar format, but we would encourage you to keep the session super interactive. So please feel free to post your questions in the Q&A box or the chat box. We do have some poll questions as well in this session, and we would really love it to have your feedback, to get your feedback so that it'll help us improve our sessions and our products. And finally, there will be a feedback survey at the end of the session as well. As I mentioned, we would love to get your feedback so that we can make these sessions more useful for you going forward. And without much further delay, I'm going to move straight into our discussion for today. I'm going to start by discussing what are the most important trends impacting radiology today. At Elsevier, our mission is to improve every single patient outcome, but very much like the rest of the healthcare industry, we're also seeing that there's a lot of pressure on our mission today. One of the biggest challenges for healthcare is the influx of patients, which keeps on increasing every year. Every year, we're seeing higher patient caseloads, and that means that there's more and more work for our healthcare professionals. This is particularly true for radiology because not only is the volume of patients increasing, but the demand for radiology is going on increasing. We're increasingly seeing that the doctor wants to see inside the patient. The doctor wants to look inside the patient's body to really find out what's going on the inside. And therefore, the demand for imaging has skyrocketed in the last 10 years. And it's not just the volume, it's also the complexity. Nowadays, we're seeing a lot of patients who come in with comorbidities, with complex conditions, and imaging is being applied to more and more complex conditions, especially in the area of oncology. And that means that the whole process of imaging and image reporting is becoming very, very complex. What that means is that our radiology professionals are faced with more and more questions every day. While they are in practice or while they are in education, they face new challenges, especially in terms of the information that they need almost every day. So what happens very typically is that, especially in radiology, whether you're a faculty or whether you're a resident, you have to always juggle so many balls. You have to try to balance practice, teaching, learning, and research, which means that you're always pressed for time and you always have a lot of time constraints. Moreover, residents in radiology are expected to learn on the job. They get very little practical training, very little practical exposure. And as a result, they're expected to learn once they're already in the clinical environment, which means that they have very little room for error. So in this high pressure environment, it gets more complicated when we think about how fast medical knowledge is evolving. COVID is a great example of this. It's an area where imaging has had impressive breakthroughs in reporting, in diagnosis, in vaccine development, in treatment, in all of those areas. But that just means that new knowledge has released so fast in the last 2 years that it's very difficult for radiology professionals or any healthcare professional to keep pace with that growth in knowledge that we see in the industry. So how do we respond? How do we healthcare professionals respond to the need for new information every day? We try to source information from multiple sources. And while it's great that we are trying to be innovative of the sources we use, we must remember that not all sources are reliable. Sometimes the images or the information that we get from Google or Wikipedia or YouTube may or may not be evidence-based. It may or may not be the latest piece of information. And when we try to have multiple sources of information that are being used within the same organization, it creates variability in care. So a doctor or a radiologist may be referring to different sources of information, and that means that there are going to be discussions, there could be differences of opinion, and all of that eventually impacts the patients. The one person who we're actually trying to help and take care of, we're actually impacting them in a negative way by introducing variability in care in our practice. So I would like to pose the question to you based on what we just shared about the challenges that we see in the healthcare environment. What challenges do you face in your day-to-day work, in your radiology practice or in your radiology teaching? So my colleague Jade has just helped to launch a poll. We would really appreciate it if you could share your feedback on some of the challenges that you face, and you can always check multiple answers. I'll just give everybody 30 seconds to respond. Think about your everyday workflow. Think about the things that you do every day, and then think about where are the areas of improvement? Where is there scope for bringing in efficiency or improving quality? And we encourage everybody to answer because your feedback is very useful for us in developing our solutions. Okay, I'm going to stop the poll now and I'll share the results with you. But if these results incite more thought from you guys, please feel free to put your comments in the chat box and we'd love to hear. So from what you can see on the poll, increasing volume of work is definitely a concern for everybody who's present in this virtual room today. And as we also noted, there's increasing volume of patients, increasing complexity of patients, which makes it very hard for you to conduct your work on a day-to-day basis. Other challenges reported are time constraints, lack of credible information. A few people also reported that they are unable to balance teaching and practice, or they're not able to contribute to research and continuous improvement. So based on these responses, if you have any further comments, any further concerns that you would like to share, please post them in the chat. And we will definitely discuss that virtually today. But like you said, some of the major challenges are time constraints, increasing volume of work, and lack of credible information. That's where Elsevier aims to support healthcare professionals, be it faculty, students, practitioners, or researchers. Our goal is to be able to provide you with the right content and resources that help you improve the quality and efficiency of your work. So what we're trying to think about is, how can you improve the quality, accuracy, and reliability of radiology diagnostics through credible evidence-based information? If you had access to credible information, how would that help you improve quality, accuracy, and reliability of your reporting? At the same time, also think about how can we enable students to sharpen their diagnostic skills, get more practical knowledge, get more experience, even though we're all working in a virtual environment more or less these days. That's where STATdx comes in. STATdx is a fabulous tool that enables radiologists to have access to online decision support, which helps to increase the speed and accuracy of their diagnostic processes. On STATdx, you actually have access to more than 4,700 common and complex diagnoses. You have access to more than 200,000 expert selected and annotated images, which you can use for referencing as well as for reviewing your work. We also have more than 1,400 differential diagnoses, again, to help you understand your reporting and your patient's conditions better. There are more than 20,000 easily sortable patient cases to help you enhance your knowledge, more than 200 basic and advanced procedures to provide more information on certain processes. And of course, there's also access to basic normal imaging anatomy, mainly for teaching and research purposes. So I'm going to pause here and I'm going to share a little bit on how STATdx is benefiting some of our clients at the moment. So when we think about our clinicians and hospitals who are using STATdx, we believe that STATdx has helped them reduce the chance of error. We hear this very often in our clinician conversations, that with STATdx, the radiologists feel more confident. And because they feel more confident, the chances of error are greatly reduced because they're able to interpret their reports much better. It avoids unnecessary testing because the quality of reporting is improved. It helps to reduce further testing that may be required. It helps to reduce fragmentation in radiology operations because every single person, whether they're in the radiology department or any other department in the hospital, they're all accessing the same source of information. They're all accessing a single truth of information, and that helps to reduce knowledge fragmentation. Of course, it helps to reduce downstream costs. As I mentioned, you're reducing tests, you're reducing errors. So that just means you're improving quality of care and reducing healthcare costs. On the education side, we also have a lot of accounts which are basically teaching hospitals or universities who are using STATdx. How this benefits universities and students is that they have access to trusted evidence which they can use for teaching. And that trusted evidence includes images, disease information, lab tables, patient cases, all of those things. They can use all of this content to help improve interpretation skills, especially for students. And that's a very, very powerful tool. The platform comes with very bulleted, summarized text, which is easy for the students to learn and digest. And all of this helps to create a culture of evidence among students. So it encourages students to depend on evidence-based sources of information when they go into practice. So now I'll hand it over to Griselda to give us a quick introduction and demonstration of STATdx. As I mentioned, if you have any questions, if you have any comments, feel free to post them in the chat box or the Q&A box, and we'll address them after this demonstration. Over to you, Griselda. Griselda, can you unmute yourself, please?
Sorry. Thank you, Natasha. Thank you, Natasha. It was very thorough explanation about what the STATdx is and the benefits of STATdx. On this occasion, I'm going to have the pleasure of show you how STATdx works. And I have to say, recently I saw an interview with from a radiologist. He's a very experienced radiologist based in Mexico, and he was saying that when he started to work in a radiologist path, he had to have a pile of books beside him to reach the correct diagnosis. And I must say that the STATdx is like having this pile of books beside you to help you. STATdx have different ways to search for a content. When you log in at the STATdx, you're gonna see the main screen, like you are seeing now. And this is divided in different areas. You can start your search by navigating in one of those areas. And you will see that each area is divided in type of documents, like diagnosis, differential diagnosis, and anatomy. If you choose one of these type of documents, STATdx is gonna show you a submenu. A submenu shows you different areas inside this particular category. Then you can choose from there what is the area that you would like to study or you would like to know more about it. As you can notice, STATdx is reducing the options that help with your search, because when you make your options more narrow, you are more close to have the correct answer. Let's go to this particular area When you go to a particular area, it's going to show you all the list of diagnoses that are in this area, external hernias, and it's going to show you the number of images that are inside there, the number of references, and also give you the opportunity, instead of jump directly into each diagnosis to see what is this diagnosis talking about, which information can bring you, if this information is valuable or not, you save time by using the option of preview, that is this eye icon. When you click this icon, you can see an overview of the entire document. You can use the scroll bar to go through all the document and read a bit what is this diagnosis about. Also allows you to see the images. You can use the scroll bar also to go through the whole gallery and even enlarge those images if you find interesting any of those images, and use the arrows to go through the whole gallery. You can go back to the previous menu by clicking the X here, or by clicking outside of the enlarged image. When you already see a couple of diagnoses, and you decide which diagnoses can be really valuable for you in this particular diagnosis that you are searching, or making a comparison, you can click in every diagnosis, and you will see the entire document. In the left hand, you will see all the content of the document, and you can scroll down and see the entire document, read piece by piece every area of the document, or you can directly jump into the different areas of the document that make it really practical to you if you want to go immediately to a specific area, that, for example, pathology, or return to key facts, or even if you would like to verify the reference inside every diagnosis, you can go to select reference, and you can click on any of the links that are here. Those links will bring you to PubMed. In PubMed, you're gonna find the information where the diagnosis come from, all the information that is related to the content that we have on this diagnosis. And I think for radiologists it's very, very useful, and so important to have a reliable information, and is what we offer here in STATdx. This is one of the ways that you can make your search and refine your search. Another way to make your search is by typing a keyword inside this inside STATdx. For example, sometimes I don't know how to spell specific words, especially if we talk about medical words. I really don't know how to type many concepts. Then STATdx help you with that as well. I'm looking for a leiomyosarcoma, and then STATdx offers you some options when you start typing. And here you are. I'm find what I was looking for, and I click on it. If I go there, I can go directly into any particular diagnosis and start looking information there. As I mentioned before, all our diagnoses are structured on the same way. That helps you to get familiar with the STATdx and find information faster. Additionally, to find information in this particular diagnosis, you can go to differential diagnosis. For example, imagine that you have doubts if the case that you are studying at this moment can be this diagnosis, but can be also this one or the one that you were in before. And then STATdx allows you to make a comparison. First, from here, you can have a preview. Like, do you remember in the previous menu, you can have an overview or every single diagnosis. But in this case, also from here, you can have an overview of what is inside this diagnosis. Then from there, you can decide, okay, maybe it's not this diagnosis, but it's not neither this one, or could be this one, or might be this one, okay? Then you can click on or the feature of compare. Then when you click at the top of the screen, you're gonna see the option compare that is available for you on this time. You can directly jump into compare, or you can decide that you want to go also, you would like to go, you would like to compare also leiomyosarcoma as well, this diagnosis. Then you can go use the menu that is beside the house icon, and you can go directly to the list and click here to compare this as well. Then you are ready with the comparison. Okay. Since you select, since I select several diagnoses, STATdx is going to show me by default only the ones that are in my main screen, but the other ones are also here. You only need to use the scroll bar to see all of them. There you have the capacity of see the text or only see images. And when you check side by side the information, you can maybe decide, no, this diagnosis is not really relevant in this in my investigation or in this diagnosis I am trying to go. Then you start to dismiss by using the dismiss option here. But maybe one diagnosis is very interesting to you and really have quite some relevant information in your investigation or in building your own diagnosis. Then you can click in the title. And it's going to bring you directly to that diagnosis to give you a better overview or give you a better chance to see how all the facts on this diagnosis. You want to study more about it, then you can go here, you read about it, you enlarge the images if you want. And you can go back to your comparison again if you want. As you can see, STATdx saves your comparison. And your comparison is here again to help you to investigate further what do you need from this case. To exit the compare and to completely disappear the comparison, you can click the option exit compare. And the comparison is completely gone. You don't have nothing on compare, and you can start another comparison again. Another really handy option in STATdx is that it allows you to bookmark every single content. If you want to bookmark the diagnosis and that you find relevance in your studies, or you find relevant in the area that you are working now, you can you can bookmark this. And you will find all the bookmarks. All of them are compiled in the bookmark option. And from there, you can dismiss by clicking this icon. And also, you can find, it's very handy that you can find the bookmarks also per category, per area, because everything you have bookmarks in different areas. That is my case. And you can find the bookmarks in this specific area. But I can imagine that now the radiologists nowadays, they have specialists in a specific category, and maybe you don't study cases and every single thing, because the radiologist is very wide, but you are specializing in an area. Then you normally you don't consult all the areas, but you are really particular consulting all the time or needing all the time information about a specific area. And that specific area could be brain. Then you can pin. And when you pin this area, then you're gonna see that the brain is your main category, and it's handy that you have on top of all the categories if needed. I showed you before how to narrow, STATdx is narrowing and narrowing your selection. But I would like to show you as you reach the diagnosis that is correct for you. But I would like to show you another way to filter, because I think when we filter our selection, that is handy, because it's making our selection narrower and narrower. And then let me look. You look for this particular keyword, okay? Then when you look for this keyword, maybe you only want to see procedures, and then STATdx only filter the procedures. Or maybe you want to see exclusively differential diagnosis, then STATdx show you exclusively differential diagnosis in this particular area. But what about if you would like to see all of them, but you want to see this in a particular category? You can see that you have all with your keyword and in this particular area. Then you will see all the information filtered by your areas of interest. Also, it's possible to filter to search not only documents, to search also images. That we know that the radiologists are very much based on images. Then many times it's very handy that you can make your search based on images. And you can return to the document. Another feature that is very handy that sometimes people use is the option of that you can print the document. Nowadays we use less and less paper, but I can imagine that some people are still using paper, and then because this platform is based on a internet connection, and maybe you want to print something to study later, or you also would like to download into a presentation. Then you can download the image and you can use inside the presentation. Give me a second, it's downloading. You're going to see something like this. And you can use for your presentations about cases or to teach radiology. That is also very handy. Okay. Besides explain you how STATdx work, how you can refine your search, you can download documents, you can have different ways of searching, how STATdx is structured, how you can find references, and how you can make the most about the STATdx. I would like to share with you that STATdx is constantly improving the platform. We constantly review documents. We constantly, every year, new content is added. Every year, new content is reviewed, and you can see the date that when the content has been updated here. You can see number of images, number of references, but also when this content has been updated. Additionally, we also improved the platform. Last year, we add a new way to claim CME, and this is the CME, time-based CME. What is time-based CME? Time-based CME is to track how long time you spend using STATdx, searching in STATdx, studying STATdx, because we know that the medicine you need to study constantly, you need to improve yourself constantly, you need to be updated, and you need to be accurate. And then one way to prove that you are constantly studying is this CME. In this time-based CME, they're gonna track the time that you are spending in STATdx. This new, as I told you, was implemented last year, and this you can track prior to December 2021. And if you go here, you choose the date, select the time frame. I'm gonna select from 1st of December till today, and then click View Activity. You can do two things. Generate a certificate that is gonna show you the global number, how long you have spent in STATdx. But also another one that I find very handy is that STATdx show you by area, because also you can download a report. In general, I spent 46 minutes, but how I spend these 46 minutes? In which areas I spend those 46 minutes? In brain, in breast, cardiac, chest, gastrointestinal, how many minutes I spent in total in each area, but particularly divided in which subcategory inside this category. I think that can be very useful to you if you can keep track of the time that you are spending in our solution. Another thing that I would like to share with you today is that if you would like to know more about STATdx, about the updates, you can consult our resource center to give us some feedback, to see the announcement of updates, see STATdx tips, or on case that you have technical issues, you can click support and go directly to support home. Over there, you can see frequently asked questions or communicate with technical support directly by email, chat, or by phone. I personally recommend the chat because it's really fast. The time of responding the chat is less than 3 minutes. And then you can share images with the people and solve your problem faster. Let's see if Natasha have some questions from the audience, and I will be more than happy to respond those questions. Thank you.
Thanks a lot, Griselda. Thank you, first of all, for that very insightful demonstration. I'm already getting some comments that this has been somewhat useful. And of course, I'm getting a few questions over here. So the first question is that is STATdx available on iPad or mobile devices?
Yes, absolutely. STATdx is available in mobile devices. You can use STATdx in iPad or sorry, I don't have user brands in mobile devices, but you bear in mind that the STATdx is about images. STATdx have plenty of information, and I really hardly recommend to use a proper device to get the most out of it, because you see the images in one side that you saw, you see the information in another side, and it's very handy if you can have the complete picture of all of this in a wider screen. But definitely you can use in tablets or in smartphones.
That's great. That's great. Thanks for sharing that, Griselda. The second question is, what modalities are included in STATdx?
Modalities.
So is it only for radiology, or are there other types of images in STATdx also?
Is for the radiologists, Natasha. Is main for radiologists, and is designed by radiologists and to attend the radiologists' necessities. Obviously,
Right.
another areas in the medicine can benefit from STATdx, but it's basically for radiologists.
Right. And you mentioned that it's designed by radiologists. The next
Yes.
question is that any comments on who are the content authors or the sources for the content?
Yes, we have the sources of the content, and every single can use. Let's share my screen again. When you go into a diagnosis, you can see here the name of the person that wrote it, and a small biography about this person. But also you can look on references, and the references bring you to PubMed for more information related to this specific document. Is how STATdx work and how STATdx is very reliable because it's based on evidences.
That's great. That's great. We still have a few more questions.
Yeah.
So for example, one of the questions is, and I know you mentioned this in bits and pieces, but the attendee is asking, how can STATdx be used for teaching?
Oh, STATdx have been used for teaching when the teachers in 2020, I had the pleasure to collaborate in a research in the University of Cantabria. This is a university in Spain, and the teachers decided to have a pilot to use STATdx to teach radiologists. Give me 1 second. I'm gonna look for some comments from the students. First of all, the teachers use STATdx, images of STATdx to plan the studies, few exercises, and also in the final exam, they use images and they use some cases to put in the final exam for students. Some of the students said it's a very interesting platform. That is the future, and basically the future just drop us in our face, because now it has been forced to study remotely, and STATdx is a great platform to study remotely. Other student comment, that really helped me on my studies, because by seeing all these images, very good quality, he said, very good quality of images, and seeing that this information is reliable and supported, helped me to understand better the cases that I have been coming through during my studies. And other student comment that is a very useful platform, because it's the other piece that I was missing into my studies. And another student said it's good to incorporate this kind of platform to studies, because at the end of the day, we start using when we are studying, we can be really master when we are practicing radiologists, and we can have the best, the most out of this. And this is and also the professors, the teachers said that it's very easy, just take information from STATdx and start planning what kind of cases they cannot bring, or what kind of images they cannot put on their teaching. That is one of the inside outs that we have from STATdx. It's not only used in this university, obviously, but is the one that we make a pilot, and we start to make some surveys inside this university, and nowadays they are still using STATdx to make the plan of studies.
That's great. Maybe as part of the follow-up email, we can share the case study with our audience, since they are asking.
Sure.
We can share this. I still have a few more questions, Griselda. The next question is, are there videos in STATdx?
Yeah, STATdx, not all our content have videos, but yeah, some of our contents have videos, and recently we add more videos into our content. Maybe with a follow-up, we can also share a links about which content have some videos. Yes, definitely we have videos there.
Okay, and then I know you mentioned this when you were talking about images, and you downloaded in the PowerPoint, but the question is, how can that image be shared within or outside the organization?
If you download, you can easily put into a presentation. If you go here. Give me a sec.
Sure.
Download. Look, you will see something like this. Okay. And then from there, you can save it and share together with your presentation, or you can start your presentation adding more content into this image.
So can they share it outside the organization, for example, external conferences?
You can share, but the thing is that without commercial purposes, with the medical purposes, because STATdx, all the images have the rights, and you can use to, for example, in University of Cantabria that we mentioned before, they use for teaching. It's not commercial purpose. You can use inside your institution to present a case, but you cannot go into a conference, use the images of STATdx and charge for the conference. That is commercial purpose, and that is not allowed.
Thank you. Thanks for that comment, Griselda. And then I have just one more question, finally. Sorry, I'm just checking here. Yeah, the last question here is that, have you received any feedback on challenges or size of the image or downtime or IT issues related to STATdx?
Sometimes we receive some feedback related to technical issues, but those are technical issues, depends of your browser, depends of your connection, STATdx is a web-based application, and you need to have a good internet connection, and you know, it is not all related to STATdx. Many times is related to the inside network or the security network that you have inside your institution. We know that STATdx work perfectly, and we don't have the feedback that is because of STATdx is not working properly. Is most of the time our technical team find out is the connection that is not working properly, or is something inside the institution itself that is not working in the way that should be.
Okay, great. Okay, good. So that brings us to the end of all our audience questions over here. If you don't mind, Griselda, we'll pause the demonstration here and I'll take the screen back from you.
Sure.
Thanks. Thank you for that insightful demonstration and the Q&A session.
Thank you, Natasha. Thank you everyone for your time. It was very nice demonstrating this tool to you today.
So before we conclude, I'd like to open another poll question based on the demonstration that you just saw from Griselda. We'd like to get your feedback on whether you think STATdx will help you improve quality or efficiency or support you in teaching, training, or for benefit your organization or your patients. It would be really helpful if we could have your feedback on this question. And again, I'll just give everybody maybe 30 seconds to respond. And while we're going through this question, I'll also share a little bit about where do we go from here. So the next steps from this webinar. Oops. There. So in this webinar, we basically discuss how STATdx can help you in your radiology practice as well as for radiology teaching and research. Griselda covered all the areas on how you can use STATdx for reporting, for improving your diagnostic skills, as well as use the images and videos for presentation, for example. If you think this platform is useful to you, please send us your feedback. We would be happy to offer a trial. Some of you already have access to STATdx. So if you have any further questions or if there were any unanswered questions from this session, please feel free to write to me. So whether you have unanswered questions or whether you would like to have a free trial, you can always send an email to me at n.gulati@elsevier.com, or you can just send us your feedback at the end of this session. So I'm going to end this poll now and share the results. Majority of the audience said that STATdx will indeed help them to improve the quality of diagnosis, and that's very important to us as Elsevier. As Elsevier, we are committed to improving patient outcomes, and improving quality of diagnosis is a very critical part of that. So thank you for agreeing. Thank you for giving us that feedback that STATdx will be useful for you in improving diagnosis. A lot of the audience also said that it will help improve radiology practice, support teaching and training, and be beneficial to your institutions as well as to your patients. So thank you so much for that feedback. With that, we conclude our webinar for today. As I mentioned, we would love to hear your feedback. So you can either click on this link, you will receive the slides later, and you can give us feedback by clicking on this link, or you can do so right now by scanning this QR code. Also, when we close this webinar, the survey will automatically pop up. So if you want to give us feedback at that point, you can do that as well. We will be sending a recording of this webinar along with, as Griselda mentioned, the Cantabria case study that she was talking about, as well as this feedback link and other resources that you can refer to. So we hope that those additional resources will be useful. And once again, if you have any questions or feedback, you can always write to me at n.gulati@elsevier.com. With that, I would like to sincerely thank Griselda for her time. And I would also like to thank our audience for joining us today. We know how valuable your time is, and we really appreciate the time that you spend with us. Thank you so much. Thanks, Griselda.
Thank you, guys.
Thank you, everyone. Have a good evening. Bye-bye.
Bye.